Welcome to Cornerstone Financial Services Group. I am Lee, the Employee Benefits Director at Cornerstone, and today we are talking about benefits that actually speak to the people. Because in 2026, staff retention isn't about ticking HR boxes. It's about protecting your culture, your customers, and your bottom line. With me is Kiama Simon, our healthcare manager and group scheme specialist. Yeah, great to have you.
Thanks, Lee. This is an important conversation because healthcare, wellness, and benefit design have become central to how people decide where to stay.
The reality with most employers is that when employees leave, they don't leave because of salary alone, but because of benefits. And when employees leave, it comes with great cost. For example, the culture that is lost, recruitment fees, and the loss in morale for employees that are left behind.
That's very truly. More often than not, it's not that employers are not investing in their employees, but it is very important that we look at the benefits that the employees have, whether those benefits are relevant, looking at how the benefit is designed and also looking at the financial aspect of those benefits.
From your experience, Kia, what are the pain points when it comes to healthcare?
So the pain points that we normally see is that members are confused with regards to their benefits, late joiner penalties that have been loaded on members' premiums, co-payments that members have to pay out of their own pocket, and also members not actually being educated in terms of the benefits that they have and how to best maximize those benefits.
When you look at our client base, there are 5 themes that come across when it comes to retention. The first one being culture and learning. What is important is that people do not only want to work, but they also want to grow.
And also, wellness plays a huge role within a company. When we're looking at wellness, we're looking at mental health, we're looking at financial wellness, we're also looking at coaching as well as career support. With those, members or employees within that particular company feel supported by the employer.
So what this means, therefore, is not only about a salary, it's about making sure that people are always growing.
Correct.
The second theme that has come across is financial support. People are financially stressed everywhere.
Exactly. And with financial issues or financial stress, that causes absenteeism. That also makes it so difficult for members to make good healthcare choices because the only thing that they're focusing on is the financial aspect of it.
The other big concern is mental health and counseling. Mental health is no longer an option.
And you know what? It is so easy for employer groups to actually have this kind of benefit where they can incorporate an EAP benefit within the company. An EAP benefit then focuses on a holistic financial wellness and mental health, as well as giving their employees good support.
Where we spend most of our time is in group schemes, stability, and cost efficiency. What can you say with regards to that?
So with group schemes, they've got what we call buying power. And what I mean by that is better pricing, better underwriting, and also better benefit structure.
Whilst we're talking about group schemes, the last theme that came across is flexibility and choice. People want to make choices within group schemes. So one size fits all doesn't work anymore. What would you like to say with regards to that?
With today's generation, things are so diverse. When you look at within a company, you've got younger people and you've got the older generation. With younger people, they just want basic benefits. When we're looking at a healthcare, they will just want to focus on day-to-day stuff. But now when you look at the older generation, they want more comprehensive benefits, So within an employer group, there has to be a balance. And that's why, like you said, freedom of choice is so important.
Kia, having spoken about the 5 pillars, from your experience and looking in 2025 and going into 2026, which of these 5 pillars has the greatest impact?
I would think education and flexibility. If employees understand that they have freedom of choice, and also through those financial frustrations, they still know that they can choose whichever benefit that they want, that actually gives them the confidence.
Now we're going to talk about group schemes and medical design. The first thing that comes to mind is underwriting and demographics. What can you say about that?
When we are creating a group scheme, demographics are very important because with demographics, we look at stuff like the average age, the gender, the salaries within the company, and that sets precedence as to what kind of underwriting the company or the employer group will get from a medical scheme.
What I've also seen happening in the past is that when benefits are presented or implemented for staff, one of the things that employers do is that they come up with subsidy models. What can you talk about those subsidy models?
Well, they are quite. It depends on the employer group, honestly, when it comes to subsidies. I mean, we normally advise that with subsidies, it can either be a percentage. So an employer group can say 50% of the total contribution, that is what they will contribute. Sometimes it can also be a rand value. They will say to you, we can contribute up to 1,500, depending also on the option that you would have selected. So it actually depends on the employer group. What is it that they are comfortable with, and also what their financials look like.
Now you've implemented a group scheme. Now the scheme is running. What could be the biggest impact when it comes to administration? And why is it so important to making sure that the scheme runs effectively?
You know, Lee, administration plays such a huge role when it comes to running a group scheme. And what I mean by that is when we're looking at our administration, we are including stuff like your billings. We need to make sure that those billings are reconciled and they're accurate on a monthly basis. We also look at the claims. I mean, members shouldn't have a situation where they have to investigate their own claims. And that's why we have an administration team, whereby our team will be there to support the members to say, if this claim was not paid correctly, why is that? We do the investigation for the members. Also, benefit education to make sure that they are aware as to what benefits do I have, how can I best maximize my benefits, and what is it that I need to do to make sure that whatever that I'm claiming for is paid correctly by the scheme.
Certainly. You spoke about education, and one thing that I've noticed when it comes to education is employee wellness programs and their return on investments. What is the impact, both from the employer perspective and the employee perspective?
I mean, from an employer perspective, that's when you get to know what employees are really complaining about on the ground. I mean, that's an opportunity for an employer to get to understand whether the particular group scheme or medical scheme is working for them, whether the benefit that they have introduced within the company is actually working for them. And also from an employee perspective, that's when you get an opportunity to actually get educated, whether it's financial education, mental health education, or even financial education. So there are so many things that can be taken out from an employee wellness program, not just looking at the benefits, but also looking at your health. Because normally with our employee wellness programs, we also incorporate what we normally call a wellness, where we bring in nurses from a service provider to come and do health checks. And that speaks a lot about members being aware of their health.
So having said that, one can clearly say that there's a good return on investment when it comes to retention of key employees. Now let's talk about how Cornerstone works and how they implement benefits for their employer groups as well as employees.
So normally as Cornerstone, what we do is we look at the culture within the company. So culture plays a very important role because that's when we get to understand what is it that the employer is looking for and also what is it that the employee is looking for, right? In order for us to make sure that the benefits that we are introducing or that we are recommending are suitable benefits, because it's not really a one-size-fits-all kind of situation. So after that has been done, that's where we now select that particular benefit, and then the implementation stage comes afterwards. Once we have implemented the benefit, that's when we now drive member education to make sure that the employees within the company understand the benefits that they have, how to best maximize those benefits as well.
Certainly. When it comes to providers, what research do you do as Cornerstone to make sure that the provider is aligned with the employer?
So from a healthcare perspective, when looking at the service providers, specifically medical aid, medical insurance service providers, or gap cover service providers, we look at the solvency ratio. We look at the administration as well to make sure that when we are placing an employer group on a scheme, from an administration perspective, will it be easy for member to navigate it if they were to do it on their own? And is that scheme strong enough to pay claims? So those are the aspects that we need to take into consideration when recommending a scheme or when implementing a scheme within an employer group.
Certainly. So if you look back 3 months after installing a scheme, what do you look at in terms of that analysis?
So we normally request for data from that particular scheme to look at, have the members started using the benefits, right? And what benefits have they been using the most? And secondly, we also have a conversation with the employees as well as the employer, to say, when you're looking at these benefits, have they been working for the employees? Because it's sort of like a review to see whether our advice has actually been correct, our recommendation has actually been correct, and this is the most suitable product for the employer.
So feedback, both from the employer and the employees, is very important.
100%.
Now, going along, if you look back in all the schemes, I know you've implemented a couple of schemes over the years. If you can choose one case study to tell us a story in terms of how you implemented the benefits, what were the stories that are coming from the employees as well as the employer in terms of the impact of those employees, but more importantly, from a retention perspective?
I mean, there is a scheme, quite a big scheme that we implemented. I think it was last year around June, July. It's a call center environment where we are dealing with young people, And at first, we had a little bit of resistance from the employees, because they are young people. They feel that they are fairly healthy. They don't need this kind of benefit and so forth. But once we had implemented that benefit within the company, that's when we started seeing the value. And what I mean by that is, when we were looking at the claims from the particular company, we actually realized that these young people actually utilize these benefits. Even though at first they felt that it's not important, but they are starting to use the benefits. Member educations that we drove at that time made it so easier for them to understand the benefit that they have. And now when we are having a conversation with them, post the wellness days that we had, post the member educations that we had, they're now starting to appreciate the benefit that they have from a healthcare perspective. And even when they leave the company to go to another company, they keep on saying to us, is it possible for me to transfer this to my own capacity? And that's when you get to see the value, to say, this is actually a product or a benefit that actually worked for them. And they're now starting to see the value with that benefit.
And to the benefit of the employer, what I've then realized with this specific company is that there was a reduction in absenteeism.
100%. I mean, you get to see that because they no longer have a situation where they have to wait in long queues at a clinic or at a state facility for them to get healthcare assistance. So even with that, it assists for the employer to also monitor whether they are overusing the benefits or whether they are misusing the benefits, if I may put it that way.
One incident I call, or a case that I call specific with this client, is when an employee's child passed away and they were distraught. And it was only a 9-year-old. And it was quite distraught in an essence that they did not have money to bury that child. And only a few months having implemented these benefits, the employee came back to us and said, thank you so much because you helped me bury my child with dignity.
Yeah, I think members get to see the benefits once they start using them, or when it's time for them to use it. At first, they might feel like, why are these benefits being introduced? Why is the company investing so much money into something like this? But once you get to a situation where you need to go to the doctor, or you get to a situation where you need to be hospitalized, or you need to bury a loved one, like you had mentioned, that's when you get to see the value within the benefits that the employer has actually implemented. As many people may know, Cornerstone Financial Services Group has got a group of 8 subsidiaries within the company. And I'm not sure, Lee, how do you think that these 8 subsidiaries might benefit an employer group, or its employees for that matter?
If you look at Cornerstone Financial Services Group, these 8 subsidiary companies are not only companies, but these are specialized companies. Let me make an example. You've got a company within financial planning, investment advisory, tax, as well as fiduciary services. When you look at an employee with their different needs, when we do our wellness days, they come with their different questions. This might be an assistance with their deceased estate. It could be assistance with their tax, with their investments. Having all these services in one house cannot be underestimated. the convenience thereof, the quick in which employees can get responses with the most pressing matters, it's quite vital. One, it saves the company time in terms of employees going around and asking questions about things that are very pertinent to them. And therefore, partnering with Cornerstone Employee Benefits does not only convenience you as an employer, but more importantly, it makes things easy for employees.
And if healthcare or wellness feels complex, book a healthcare and wellness gap audit. We'll identify quick wins from subsidy design to admin fixes and wellness initiatives.
If your benefits aren't speaking to your people, they will listen elsewhere. Book a benefit audit with Cornerstone. We'll show you the practical, cost effective changes that protect your culture and reduce turnover.